Namaskar. We would like to welcome you all on behalf of Independent Research Society. And the series is AYUSH SAMRIDDHI International Conference Series. Due to your mentorship, blessings, cooperation, and active participation, we have been able to touch the milestone of 1872 within 4 years, as well as we have to achieve the target of 50 countries in the world where we are having subscriber in our list. Thank you very much. And I would like to communicate my sincere thanks and regards to Professor Kamini Dhimanji. Namaskar, madam. Thank you, because this woman wellness series and infertility series, both series are due to inspiration of Madam Kamini Dhimanji. Thank you very much for inspiring us as well as introducing so many beautiful orators, dignitaries. Thank you very much, madam. Thank you very much. I would like to communicate my regards to Professor V.K. Agnihotri sir, Dr. Dineshwar Prasad sir, Dr. Nishan Shukla ji, Professor Lakshmikant Dovedi sir, and everybody who has joined our meeting today. Thank you very much for joining AYUSH Samriddhi International Webinar Series and Women Wellness Series of Prasuti and Stri Rog is there in 1872. After that, 1873rd webinar will be on Karnataka Foundation Day, Ayurveda in Karnataka, history and development. So the topic is also unique and experts are also unique. Their director, B.S. Sridhar, Principal Belgavi, Dr. Suhas Shetty, Principal JSS, Dr. Sarveswarkar will guide us on the topic. And at present webinar, I am really grateful to Dr. Bahita ji, our today's speaker on the dais. Welcome, madam, welcome. This platform is dedicated to you only. Please guide us whatever to be done and please participate actively. And Kamini ji is our guide and coordinator for the series. Thank you very much, madam. Now I would like to request Professor V.K. Agnihotri sir for brief preamble. Then our respected Kamini ji will take over the stage. आपकी आवाज नहीं आ रही है सर. आप कहीं रास्ते में लग रहे हैं.
वीडियो
आपकी आवाज नहीं पहुंच रही है सर. हम बाद में आपको इनवाइट कर लेंगे, डोंट वरी. मैं अब डॉक्टर कामिनी धीमान जी को सादर आमंत्रित करता हूं. डॉक्टर कामिनी जी.
जी नमस्कार पवन जी, अग्निहोत्री सर, और जो भी हमारे सीनियर लोग जुड़े हुए, लक्ष्मीकांत द्विवेदी सर, निशान शुक्ला जी, एंड ऑल दी सीनियर फैकल्टीज, and especially I would like to thank our speaker, Madam Wahida Rahman. She is a very well known practitioner, very well known orator, and she has treated many cases of infertility as well as all the gynecological problems. And I would like to welcome all the participants who have joined over here. And as far as the topic is concerned, we are going to discuss in this November month the growth disorders, all the abnormal growth disorders. One of them is endometriosis. कोई भी ऐसा मेरे हिसाब से आजकल के टाइम में ऐसा डॉक्टर, वैद्य, प्रैक्टिशनर नहीं होगा जिनके पास इस टाइप का कोई भी केस आया ना हो. Each and everyone is facing such type of issues in the OPDs nowadays. and what can be the appropriate answer, what can be the appropriate treatment for that particular patient. When I thought about this topic, I found the name in my mind, Madam Wahida. She will be the right person to throw light upon this. I thought like that. So I invited her, and she immediately uh, agreed that, okay, I am agree to say upon this topic. And all the our participants will enjoy. And after that, the talk of the madam, we can have the discussion of the senior members. Lot many times it is like that, after the presentation of the speaker we are not getting time. So today we have taken only one speaker, as madam will take very detail, and after that we will discuss about the questions and doubts of the all the participants. Madam will discuss all the cases also. So directly I would like to invite Madam Wahida. Madam, over to you.
Thank you, ma'am. Thank you very much,
Yeah,
ma'am.
you can share your PPT also, and you can start the topic, madam.
Okay, ma'am. Yes, ma'am. Is it visible?
Yes, visible, very nicely visible.
Okay, okay, ma'am. In the name of God Almighty, with the blessings of all my gurus, Gurupada Padambhoja, Paraga Vishadekshana. Welcome all respected doctors and Ayurvedic practitioners to today's discussion topic, that is about the management of endometriosis, or the endometriosis management Ayurvedic perspective. As Kamini Madam said, we are all practicing Ayurvedic doctors. We met lot of case with the endometriosis in our day-to-day practice. In early days, it is not so much problem, but nowadays it is so much problem, because each and every day will cover at least 10 or 20 endometriosis patients to my OPD. That is why it is an important thing to discuss endometriosis, because this endometriosis will cause serious health issues to the women and reproductive issues. More than effect, it may cause adenomyosis and further complications in the life of a woman. So, as it is a woman wellness program, endometriosis is one of the apt topics for discussion. And coming to the endometriosis. Endometriosis is an enigmatic disorder. Its natural history is uncertain. Its precise etiology is unknown. This is the definition of modern. And clinical presentation is inconsistent, and treatment is poorly standardized. Coming to the definitions, the endometriosis, the presence of functioning endometrium in sites other than the uterine mucosa. Adenomyosis means the presence of functional endometrium, endometrial tissue in the myometrium. These are the two stages of endometriosis. One, endometriosis interna, and the other one, that is the endometriosis, is endometriosis externa. And the endometrioma, the area of endometrial tissues present usually in the ovary. And the chocolate cyst of ovary, when endometrium filled with blood resembling tarry chocolate colored syrupy fluid, it is known as the chocolate cyst. And we all know what about the endometrium. The endometrium is mucus lining of the uterine cavity above the level of internal os. Consists of surface epithelium, stroma, and blood vessels. Two divisions having basal zone and functional zone, and contain receptors for progesterone, which are induced by estrogen. This is the normal site of endometrium. But when the endometrium moved to tubes, ovaries, peritoneum, etc., it is known as endometriosis. When it is moved to the myometrium, it is known as the adenomyosis. Sites of endometriosis. Most common sites are pelvic organs and peritoneum. Abdominal, that is ovary, POD, pouch of Douglas, uterosacral and broad ligaments, rectovaginal septum, rectum and pelvic lymph nodes. Rare sites are gut, appendix, ureter, and urinary bladder. extra abdominal sites, the abdominal scars following hysterectomy or umbilical or episiotomy scar, cervix, vagina, etc. And the remote sites is pleura, lungs, deep tissues of arms and thighs, etc. The common sites, ovary, 50% of case. Then pouch of Douglas, uterosacral ligaments, rectovaginal septum, abdominal scar following hysterectomy or following laparotomy or LSCS section. Sites in order of frequency, that is ovary is the most common site, then POD, then uterosacral ligament, rectovaginal, sigmoid column, rectum, etc. Adenomyosis, ectopic endometrial tissues in the myometrium lay down poor endometrial support for pregnancy. So the adenomyotic uterus is bulky and having glandular appearance in the myometrium with a stroma and also very severe congestive dysmenorrhea during menstruation, and also it produces severe heavy bleeding also. This is the picture of ovarian endometriosis and also POD and uterosacral ligament, etc. This is the endometriosis deposits. This is the adhesions due to that endometriosis. This is the disordered fallopian tube, uterus. That is endometriosis. We can understand it is a bhavishyatah kushta samam vyadhi. Here, inflammations is there, adhesions is there, and spots are there, and also vakri garodi, the organ, that is the aveva, that is the uterus, fallopian tube, ovary, and the pelvis, etc. So, bhavishyatah kushta samam vyadhi, that is the endometriosis. Coming to the etiology, non-factor very similar to uterine leiomyoma, more common in highly civilized communities. Age group between 17 and 40, and close relatives and homozygote twins having more chance. Frequent in private practice than government hospital because it is known as a disease of rich. And 50 to 70% of affected women are childless. That is, it will interfere with the fertility. And classification, we see the scan report or the report of report with the patients, that is stage 1 endometriosis, stage 2, 4, etc. But stage 1 endometriosis means superficial implant less than 5 millimeter on pelvic peritoneum, and stage 2 means superficial implants on uterosacral ligaments, ovaries, rectovaginal septum, and stage 3 means ovarian endometriosis more than 5 millimeter. And coming to stage 4, pelvic spread to vagina, bowel, and urinary tract. And stage 5, endometrioma to the adenocarcinoma. This is the classification of endometriosis. And epidemiological risk factors, peak incidence in 2nd and 4th decade of life. Patients are over anxious, highly intelligent, perfectionists, giving more importance to their career. They are giving more importance to their career, and they will have the habit of suppression of natural urges, that is Vegadharana, especially the Mutra Vegadharana. In Mutra Vegadharana, we can understand Angabhanga Asmeri Vasti Metra Vankshana Vedana Mutrasya Rodhal Jayande. One of the main cause for Abhana Vaigunya is the Mutra Vegadharana, especially in working women studying studying students, etc. The Mutra Vegadharana is one of the main cause for producing endometriosis or the pelvic pain, etc. Late marriage and childbearing beyond 30 years, and duration of menstrual cycle less than 27 days or more than 1 week of flow. Here, the menstrual cycle is regular. There is no delay in menstrual cycle. Regular or 26th or 27th day cycle, or at least 28th day cycle, etc. 7 times more common in relatives. Increased risk with the obese woman. May be associated with the hyperestrogenic conditions like fibroid, adenomyosis, endometrial polyp, hyperplasia, anovulation, PCO, and cyst of ovary. These are the complications. Genetic theory, familial clustering, and multifactorial inheritance. Induction of human-like endometriosis by genetic activation of an oncogenic KRAS allele supports the genetic basis of the endometriosis. Pathogenesis. No single theory can explain the location of endometriosis in all cases. So, theory of retrograde menstruation and implantation, transplantation, and coelomic metaplasia, induction theory, implantation theory, and lymphatic and vascular theory. These will explain in different types of endometriosis. Retrograde menstruation and transplantation. Seeding and implantation of endometrial cells by transtubal regurgitation during menstruation. This is by Abanavada Vaigunya, especially the Urthagada Avanavayu. And retrograde menstruation and transplantation, Vegadharana, causing Pradiloma Abanavayu, then we shed the rajas, and Udavarta Ruba of rajas, spill of rajas to the neighboring sites, then implants there. Nowadays, there are many incidents with the menstrual cup use also, which will also cause this endometriosis or adenomyosis. I think there are so many cases coming. Theory of coelomic metaplasia. Transformation of coelomic epithelium into endometrial tissue. Here, Vyanakopa, then Doshakopa with increased kapha, abnormal functioning of coelom, genetic power induced by kapha and generates endometrium. And then Pradiloma abana, Udavarta raja, vitiates other doshas, irritates the peritoneal doshas, induces abnormal prajanana in Mullerian tissue, endometrial tissue is formed. Coming to the induction theory, here development of undifferentiated peritoneal cells into endometrial cells by the induction of an endogenous biochemical factor. Implantation theory can explain endometriosis of abdominal scar following by hysterectomy, myomectomy, cesarean section, and tubectomy. There is a scar endometriosis. Endometriosis at episiotomy scar, vaginal or cervical sites, etc. These are with the implantation theory. And lymphatic theory could explain the pelvic lymph node involvement and ovarian endometriosis. Then vascular theory can explain endometriosis at distant sites such as lungs, arms, thighs, shoulder, etc. Other factors, genetic factors, immunological factors, and subclinical peritoneal inflammation, release of prostaglandins, quantity and quality of endometrial cells. Embryonic cells may give rise to deposits in distant sites such as umbilicus, pleural cavity, and even in the brain. Environmental factors and dioxin. Dioxin is a substance coming from the burning of plastics, etc. That is some environmental pollution. Clinical features. 50% of case completely asymptomatic. So, we get the patients with the symptoms only. 50% of patients may be asymptomatic and come to any other reason or any other problem. We can accidentally see the cases, etc. Then pelvic, lower abdominal and dull aching pain in 70% of cases. No pain in 30%. The classical feature of endometriosis is dysmenorrhea, but there are endometriosis having no pain also. In 30% of cases, no pain. And this type of cases can be identified with a sudden abdominal pain and torsion of cyst, etc. Emergency laparotomy, then only they know they have endometriosis, etc. Then deep dyspareunia and postcoital discomfort for 27%, dysmenorrhea 27 to 35%. And 5 Ds of endometriosis, that is dysmenorrhea, deep-seated pelvic pain, dyspareunia, dysuria, and dyschezia. All the Ds are the painful menstruation, deep-seated pelvic pain, that is the kadi vankshana vedana, and dyspareunia, painful coitus, and dysuria, painful urination, and dyschezia, painful defecation. And then the clinical features continuing. that is infertility. One of the major clinical features of endometriosis is infertility, menorrhagia and premenstrual bleeding, 12 to 15% of cases, and intermittent fever during menstruation. Some people complain of intermittent fever during menstruation, and there is intermittent pain and fever during ovulation also in deep endometriosis. Tumor formation. Less common symptoms are hematuria, dysuria, and frequent micturition, rectal bowel IBS, hemoptysis, cutaneous nodules, and hyperprolactinemia and loin pain. These are the less common symptoms. Then coming to the Ayurvedic point of view, Garbhashaya Taijasa Bhava, predominant Pitta, then susceptible to Rekta Mamsajanya Vigara, that is the Andarvidradi. So, it is known as Sarekta Sannipadaja Vyadi, that is endometriosis. Pelvic pain, Parshandara Shola, Vrishtigeriva Dakshyade. Then LBA, Prishtakadigraham, dysuria, Krichalpa Mutrada, and constipation or diarrhea, Gude Vada Nirodhastu. Diagnosis, history and clinical examination, non-invasive test and laparoscopy. History and clinical examination, pelvic tenderness, fixed retroverted uterus. We know the normal uterus is antiverted and antiflexed. Due to the adhesions, etc., here the fixed retroverted uterus. Then tender uterosacral ligaments, enlarged ovaries. The presentation is variable. And on examination, per abdomen examination, there may be chocolate cyst, tubo-ovarian mass, tender restricted movements is there. Per vaginal, POD having nodule and tenderness. Per speculum, posterior pernicious bluish spot. There may be bluish spot. Per rectum, if there is any rectal endometriosis. Then diagnosis, laparoscopy, USG with color Doppler, MRI, and serum immunoassay, that is raised CA125 glycoprotein. CA125 is a glycoprotein raised both in ovarian tumor and also in the endometriosis. If the value is more, then there is a chance for getting malignancy. In normal endometriosis also, it is in a raised manner, 75, 100, 150, etc. Because less than 34 is the normal value. But in normal endometriosis, we can see the cases with 75, 100, 125, etc. Then we are doing management, and if with our management, if it is reducing, then we can assure that your endometriosis is reducing. This is the clinical evidence. Complications. Endocrinopathy, rupture of chocolate cyst, infection of chocolate cyst, obstructive features like intestinal obstruction, urethral obstruction, hydroureter, and hydronephrosis, that is renal infection. Then malignancy, adenoacanthoma. 2% case ending in malignancy. Endometriosis and infertility. This prevalence is 50 to 70% in infertile couples. We know two of the two causes for infertility, for female infertility is one the endometriosis, other the PCOS. These are the two major causes of infertility for female factor only. Then if we understand the endometriosis in early, we can treat with our Ayurveda and we can regain the fertility of the lady very well. I think all the other conventional medicines have just pain relieving measures, etc. There is no clear-cut treatment for endometriosis or the PCOS in a good manner. In Ayurveda, only the management will give the good result, and in PCOS especially with a strict diet and good exercise, and also in endometriosis with the clear medicines and exercise with the pranayama, etc. will give good result. Probable cause of infertility in endometriosis. First one, there is retrograde menstruation. Production of prostaglandin by endometrial tissue may adversely affect ovum pickup or tubal motility. Increased level of prostaglandin in peritoneal fluid, tubo-ovarian masses, peritubal or peri-ovarian masses, distal end proximal occlusion of the tube. That is the flimsy adhesion in the fallopian tube. We all know all the animals humans, etc., the conception occurring in the fallopian tube. If there is a flimsy adhesion, the tube cannot pick up the ovum and it will not move the sperm to the ampulla of the tube for fertilization, or if it occur, it will not allow to the zygote to implant in the endometrium, because there may be restrictions in the movement, there may be adhesions, more chance for getting ectopic pregnancy, etc. And then 27% of patients have ovulation disorders, corpus luteal insufficiency, and luteinized unruptured follicle in 25 to 45% of cases. Differential diagnosis coming adenomyosis. This having similar symptoms, but it is seen in older age group and multiparous. Uterus is enlarged, nodular, and tender. PID having similar symptoms, bilateral tender broad ligament also, mass is usually duff and fluctuant, leukocytosis, rise DSR is there. Ovarian carcinoma and occurring in older age group, solid nodules in cul-de-sac. Treatment, reassurance and education is the first line of treatment. Diet low fat, preferably vegetarian diet is good, and psychotherapy for alleviating their depression, tension, stress, etc. Then pharmacotherapy with proper medication, we will explain later, and treatment of secondary dysmenorrhea direct to specific underlying causes. And coming to the modern treatment, hormone therapy, here they use pseudo-pregnancy regimen, suppression of menstruation by larger dose of progesterone for 6 months. And use the agents methoxyprogesterone acetate. Advantages, glands may be destroyed and may get permanent cure in some of cases, but most of the cases end in disability. And disadvantage, nausea, vomiting, malaise, discoloration, hypertrophy of uterus, enlargement of leiomyoma, and inevitably infertile patient. These are the complication or disadvantage. And coming to the laparoscopy, procedures are endometriotic lesions and adhesions are excised or coagulated using bipolar coagulation of carbon dioxide laser. Then additional lysis and preservation of normal ovarian tissue in women who desire fertility. Advantage, less invasive and less expensive, less morbidity, better post-operative result. But subsequent pregnancy rate is 30%. In case of dense adhesions with bowel and bladder, hysterectomy is the choice. And danazole pseudo-menopause therapy, that is direct depressant action on endometriosis by androgens. Danazole, derivative of 17-alpha-ethinyl testosterone with minimal androgenic activity. Drawbacks, also nausea, weight gain, fluid retention, hirsutism, reduced breast size, liver dysfunction, androgen effect of the fetus. Other include GnRH agonists by blocking FSH and LH from the pituitary. Why we explain this? Because our patients are coming with so many bundle of purpose. That is, they took this treatment, etc. To understand what are the power of that medicine, what are the complications, etc. We will know this treatment. And coming to the Ayurvedic references, here in our classics, there is no direct mentioning of the disease like endometriosis, etc. But symptomatic correlation to Vadiki and Vadadushtartavam. General etiology of this disease, that is Mithyajarena Strinam, Pradushtena Artavenacha, Jayande Bija Doshascha, Devacha. And coming to the Ayurvedic view, that is Vadigi, Vadacha Pradara, Udavarta, Paripluda, Rektapitta, Vadagulma, Vadajagrandi, Andarmukhi. These all having some symptoms in endometriosis. Symptomatic correlation, that is Yono, Krutho, Anila, Kuryat, etc. That is pelvic pain due to, it is the explanation of Vadigi. Pelvic pain is due to adhesions, stretching of pelvic peritoneum, alteration in pelvic blood flow, defects in ovarian nerve supply, pelvic nerve pathway to uterosacral ligament, pelvic prostaglandins. These are the reason for pelvic pain. And the carcasium, that is the hypoestrogenic condition, that is the carcasium, Rutshada. Then Pibiliga sriptamiva may be due to pain elicited from adhesion to ovary during follicular maturation time. And Vyadha gulmam kramenaja, cyst with a blood or tumor developing condition in endometriosis. Then Vadadushtartavam. Bhenilam, Ruksham, Alpam, Vichinnam, Sarujam, Chiracha Nishpadyade. It is abnormal menstruation due to abnormal endometrial implants, alteration in pelvic blood flow, due to pelvic adhesion, severe pain present. Ayurvedic management, it is managed with Andarvidradivat Chikilsa, Vada, Pitta, Kaba, and Rektavidradivat Chikilsa. Then Yoni Vyabat Chikilsa, Vada, Pitta, Yoni Vyabat Chikilsa, we can incorporate. Treatment should aim Vada, Pitta, and Rekta. Sthanika Chikilsa, that is after the Shodhana therapy or after the treatment, Sthanika Chikilsa also important in the management of endometriosis. Vadolbaneshu dosheshu vadeva vastishyade, etc. Then vastirustarastena sadhe. Here the Sthanika dosha is more, so Uttaravasti is indicated as Sthanika Chikilsa. Coming to the treatment in Ayurveda, this is the protocol made by means the practitioners in Kerala. Especially we are using so many medications, but we made the most medicines for endometriosis or most result medicine for endometriosis. In primary, secondary, grade 3 endometriosis, etc. It is easily curable with our Ayurvedic medicine, like Nirgundyadi Kashaya. It is said in the Krimi Chikilsa, Nirgundi, Karavi, Krishna, etc. And it is a very good anti-inflammatory medicine and also antimicrobial medicine with the Gobi Chandanadi Guliga in the morning. And then Sugumaran Kashaya, it is a good anilomana drug, and the Hingutriguna or Pipalliadi Anivasana Taila in the evening. Here, Hingutriguna is using because it is said in the Rekta Gulma Chikilsa, it is Gulma Harathum. It is a natural adhesionolystic agent, that is the Hingutriguna Tailam. Hingutrigunam, and it is a natural adhesionolysis having Gruksha Svabhava, and it is not Ubashaya for Pittarshas or Rektarshas condition. So, if the patient is having Pittarshas or Rektarshas, then use Pipalliadi Anuvasana Tailam, which is also a good Anuvasana medicine. And but this Anuvasana Taila having an adhesionolysis property, but not as much Hingutriguna Taila, because Hingutriguna Taila having this adhesionolysis within 3 months, and the Pipalliadi Anuvasana Taila may take more than 3 months, that is 4 or 5 months it is needed. Then Aristas, according to the condition of the patient, according to the digestive capacity of the patient, and diabetes or etc. conditions, we can select Aristas like Abhaya Arista, Kumari Asava, Sharibadi Asava. If the patient is having diabetes, then Ayaskriti, Lodhrasava. According to the condition only, we can take that Aristas. Then Hinguvajadi Churna, because all the endometriosis having some gastric irritations, some gastric lakshanas, etc. So Hinguvajadi Churna and Indupuganan Churna, both these churnas having an effect on alleviating this gulma-like condition and the gastric irritations. Then Abhyangam with Dhanvantaran Tailam, and also Piju with Jadamayadi Lebachurnam with Dhanyamlam. It's a good local application for reducing the size of the endometrioma and also reducing the pricking pain. That is there is some pain before menstruation and also during the menstruation. Some cutting pain is there. So the Piju and Dhara with the Dhanyamla is one of the good measure for reducing that severe pain. And Avagaham with the Vadakhina Patra Siddha water. Conditions and then treatment continuing. Then Garbhashya Shodhana Kashayam. Garbhashya Shodhana Kashayam, it is said in Vaidyataraga or Arogya Raksha Kalpadruma, that is Deshamula Anicha Nalinam Sprikka Erenda Shivascha Payel Sapayak Kwadaha Garbhashaya Vishuddhe. After giving Nirgundyadi, etc., we can give Garbhashya Shodhana Kashaya for preparing the Garbhashya for fertility, etc. This Deshamulam, Nalinam, Sprikka, Erenda Shifascha, Payel, Sapayak Kwadaha. It is very good for preparing the uterus for conception after endometriosis or adenomyosis. After the management, we can use Garbhashya Shodhana Kashaya. And if there is tubo-ovarian mass also, we can use Garbhashya Shodhana Kashaya with the Ushagadi Gyana as Praksheba Churna. That is Ushaga Tuttaga Hingu Kasi Sadvaya Saindavam. Then as Praksheba Churna. Then Chirivilvadi Kridam. If there is endometrioma and also large adenomyoma, it is alleviated with the Chirivilvadi Kridam. And then Ashoga Kridam. If the endometriosis is associated with a severe bleeding, the Ashoghrida is one of the good measure to treat the severe bleeding with endometriosis. Gobi Chandanadi Gulika along with Nirgundyadi is better. And if the pain is more, then we can use Saptasaranga Kashaya and Arthavilyam Kashaya, etc. Arthavilyam means it's also one Malayala yoga, that is Arthavilyam Arakujiragam Eshtirushagam Pavumait Vachakashayam Anbodu Panjasangyam Kudikilo Padutalinya Vranangal Andarvidhadi Pidagadigal Tarshamarudameta Sarpa Shirasupoludungidum. It is like the Sarpa is defeated by Lord Krishna, that is in the Kaliya Mardana. Like that, the Andarvidradi will defeated by this Kashaya. This Kashaya means Arthavilyam is a measurement of the Arak means that is Laksha, and Jiraga cumin seeds, and Eshti Madhu, and Dushaga, that is the Parushaga, and Pau means the Madhusnuhi. This Kashaya, that is Laksha, Jiraga, Eshti, Parushaga, and Madhusnuhi Kashaya. We can take for 5 days continuously, then 1 week rest, then 5 days continuously, etc. Which will reduce the size of the Andarvidradi, like the Sarpa is, the Kaliya Sarpa is defeated with by the Lord Krishna. And coming to the magic trick of my infertility practice, that is the Shatapushpa. In all endometriosis case and adenomyosis case, there is decrease in the AMH value, AMH level. AMH is one of the important part for the fertility. That is Rudu Kshetra Ambu Bijanam Samardhyat. Here, proper AMH is need for the proper nutrition and also proper bija. So both the nutrition and bija can be corrected with the use of the Shatapushpa. In Shatapushpa Shadavadi Kalpa, Kashyapacharya said that Rejo Nivrti Namcha Putrada. In Rejo Nivrti, there is the decrease in the AMH value, etc. Even in Rejo Nivrti Namcha Putrada, then we can use this Shatapushpa in the condition of reduce the AMH level while treating the infertility associated with endometriosis, adenomyosis, etc. We can use the Shatapushpa Churna in different Anupana. According to the classical test, also we can use Aknigamastu Madhuna, Belina, Kshira Sarpisha, Mamsavasaya, Malsyaresaya, Khadira Sarena, etc. According to the condition of the patient, we can select the proper Anubana for the treatment. Here, with the endometriosis patient or adenomyosis patient, we can select the Shatapushpa Churna with the Bhala Sarpis or Sugumara Kridam, etc., which having more fertility value. And also, if the patient is obese, we can use this Shatapushpa Churna with the Tilataila. Then next one, this is the Clerodendron, that is the Bhandari. We can use this medicine in the condition like a tubal block, flimsy adhesion, tubal block, partial block, etc. In complete block, we can try with this medicine, but it is not curable, the complete block. 1 or 2 cases and giving good result. But in flimsy adhesion and partial block and history of previous ectopic pregnancy, we can treat very well with this medicine. That is root of this medicine. This is the Bhandari. Root of this Bhandari we can take and devoid of the outer skin and inner thick part. We can make a paste with the cumin seed and 1 root, half teaspoon cumin seed. We can make a paste and half glass milk plus 4 glass water, boil well and reduce to 1 glass, and we can use for daily taking, internal taking. This is a good medicine for the tubal motility clearance. That is the tubal cilia clearance, tubal motility clearance, etc. Natural source of tubal cleaning. And coming to the treatment modalities, Snehabana with Kashmiriadikradam, Swedanam, Nadi or Kumbhi type of Sweda, Vasti, Guluchiadithailam, then Pijudharanam, Guluchiadithailam and Rasnadithailam, Kalkadharanam, Himsra Kalkadharanam, and Vadadushtartava Chigilsa, Snehabana with Bharni Madhuga, Bhadradaru Siddham Kradam, then Kashmiriadi Chirapagam, Priyangu Tilakalkadharanam, and Prakshalam with Aragadhari Kashayam. Then coming to the Uttaravasti, it is a Sthanika Chikilsa said in the endometriosis, because we know the endometriosis having some organ deformities. So Sthanika Chikilsa is needed if the deformity is more. According to our classics, our treatment, it is said that Chikilsaya Pradhanam, Avasthana Vidhanam. According to the avastha of the patient, we can select if she is needed the Shamana Chikilsa alone, of Shamana with Shodhana, or with Sthanika Chikilsa, etc. According to the condition of the patient, we can select. We know Tatra Alpe Lenghanam Pathyam, Madhye Lenghana Pajanam, Prabhude Shodhanam Tathi Muladun Mulayet Malan. So, when we coming to the Sthanika Chikilsa, before that, all the Shamana Chikilsa should be taken. That is, Sarvadaha Suvishuddhasya Shesham Karmaha Vidiyade, Vastyabhyanga Parishega Praleba Pijudharanam. So, before entering the Sthanika Chikilsa, all the Shodhana Shamana therapies we can do initially. Then, coming to the Uttaravasti, Ridu, it is doing in the Ridu period, that is the follicular phase, and 2 to 3 after the menstruation, after 2 to 3 Niruhavasti, Snehana, that is local Abhyanga, and Svedana Avagaha, as Purva Karma. Then keeping aseptic precautions, coming to the Pradhana Karma, that is patient is in the dorsal or lithotomic position. 10 angula Vastinetra is inserted, 4 angula of vaginal canal. Dose is 1 pala for the vaginal Uttaravasti. Here we are practicing 2 types of Uttaravasti, intra-cervical Uttaravasti and intravaginal Uttaravasti. Most commonly we are practicing intravaginal Uttaravasti, and in a rare case, if there is needed only the intracervical Uttaravasti we are doing. Then for cervical Uttaravasti, only 8 drops we are taking. For intravaginal, we take 1 pala of medicine. And some medicines come out. 2 to 3 or 4 vasis in 1 ahoratra, that is 24 hours. Procedure continued for 3 days. Then 3 days step, repeat for 3 days. And this way, during one cycle, we are doing twice, 3 days, twice Uttaravasti. Then Paschat Karma, Varti after Uttaravasti, that is, in Charaka Chikilsa, Charakan Siddhisthana, it is said that thick blood to retain medicine, rest in dorsal position. And medicines for Uttaravasti, if the condition is severe adhesions is there, tubal adhesions is there, then use Charadailam, Karpasabijadailam. Charadailam and Karpasabijadailam in less quantity, it is the intracervical Uttaravasti. Then in moderate case, Punarnavadi Thailam and Panjamla Thailam. And in mild case, Shadavaryadi, Dhanvandaram and Mahanarayana Thailam. These are the medicines we are taking for Uttaravasti. Moderate and mild case, only doing intravaginal Uttaravasti. In severe case, if there is needed, only doing intracervical Uttaravasti. While keeping precautions, because intracervical Uttaravasti, if the force is more, if there is any, there is more chance for getting complications, that is septic shock, syndrome, etc. Is more chance. So, should be done in complete aseptic measures and with keen observation. Mode of action: cervix pulled with medicine, absorption vaginal mucosa, posterior fornix and cervical canal, local effect to the reproductive system. And one of the important thing in the endometriosis management is a stress management, because due to the severe pain, severe dysmenorrhea, and the dysmenorrhea that abate the lady for doing their day-to-day activities, etc. So she's on severe stress with this pain, with the complaints of the others, etc. So do Dhi Dhairyatma Vijnana first, convince the patient and teach the patient what are the causes of this pain and how we can treat this condition, etc. Then assure the patient, then give medicine and do in a keep touch with the patients for alleviating their doubts, etc. with other SMS or WhatsApp, etc. for alleviating any doubts in between the treatment, and closely watch the patient in after each and every menstruation. Within 3 cycles or 4 cycles, the endometriosis can be reduced to a good extent. In mild case, complete cure we can attain within 3 cycles. After 1 cycle, the patient will tell there is 60% reduction of the pain and associated symptoms. After 2nd cycle, the patient tell there is more than 90% reduction of the pain and associated symptoms. And the 3rd cycle, some patients will hug us, that is, there is no pain. Then by the severe several years, they are experiencing the severe pain, and after the 3 months treatment, there is no pain, and they did not think about the menstruation also. Like that, result is also coming. Coming to the pathya, it is the pathya said in our classics, that is yoni rogas. Diet made with barley, that is eva annam abhayarishtam Sidhum Dailam Jashilayet, Pipellayora Pathyani, Prayogamsya Samakshigan. That is the Pathya we hear also. And coming to the conclusion, that is endometriosis is a benign gynecological disease commonly affecting women in reproductive age group. Etiology is unknown, but prolonged retrograde menstruation and immunogenic factors, toxins may be contributory. Commonest presentation is pelvic pain and infertility. And recurrent rate is high in 10% after 1 year and 50% after 5 years. Mild to moderate endometriosis without high tubal adhesions and large ovarian endometria will easily respond to Ayurvedic management. Ayurvedic treatment with laparoscopic procedures may provide fantastic results in grade 4 or 5 endometriosis, etc. After laparoscopic procedures, we can do our Ayurvedic management, Garbhasheshoda, Kashaya, etc. to regain their fertility and to improve their fertility, improve their ovarian reserve, etc. Ayurvedic gynecology certainly includes endometriosis not as a single term, as its clinical correlation met in Samhitas. In its management, combined Shamana and Shodhana therapy, including Uttaravasti as a whole, bring proper functioning of the reproductive system. Thus, fertility will improve. That is, Strihi Moolam Abadhyana, Strihi Rakshadi Rakshida. By this, I would like to express my sincere thanks to Dr. Kamini Dhiman ma'am and the coordinators of this AYUSH Samriddhi for giving me an opportunity to present the endometriosis topic with you. We can now the time for discussion. We can discuss case if there are any, and we can discuss any of the doubt regarding this topic, etc. My humble prayers to all the Ayurvedic doctors, that is, love Ayurveda, live Ayurveda, and learn Ayurveda well. My prayer is Sreyo Bhuyat Sagala Jananam. Thank you very much, ma'am, and thank you all.
Thank you, madam. It was really very nice presentation and all practical aspects we have covered. Now session is open for discussion. We will take questions, and the experts, many experts have joined over here. They can share their views also in this topic. Endometriosis is very common nowadays, as you told in your presentation.
Yes.
In each and every age group, I have seen that patients are having this problem. And generally, patients are coming to us that I am having endometriosis. Is there any management in Ayurveda like that? They are coming to us after taking lot many treatment protocols, after following lot many treatments. After that, they are coming to us, and there we have to find out the solution for those patients, as you told. And we have to prescribe the medications, and lot many new medications you have shared in a presentation that was new to all. And really very nice presentation. I would like to invite Dr. Anjana madam if she want to share her views on this topic. Anjana madam, Anjana Saxena. if she is there. Anjana madam.
जी मैम नमस्कार मैम। बहुत बहुत
नमस्कार।
प्यारा आज मैडम ने। जी मैम नमस्कार सभी लोग को। और स्पेशली मैडम ने बहुत अच्छे से प्रेजेंट किया। एंडोमेट्रियोसिस रियली इस समय एक चैलेंजिंग टॉपिक है हम सभी के लिए। और जो मेरा अपना एक्सपीरियंस है, मेरे पास इस समय एक पेशेंट चल रही है, उसकी एज कम से कम 25-26 साल की गर्ल है, वो अनमेरिड गर्ल है और उसको ग्रेड 3 एंडोमेट्रियोसिस है, जैसे मैडम ने बताया। उसको सीवियर पेन होता है ड्यूरिंग मेंस्ट्रुएशन और वो पेशेंट पूरा
मैडम एक मिनट आपको मैं रोकूंगी मैडम। मैडम वही था, यू स्टॉप शेयर स्क्रीन
Okay,
then we
okay,
can
okay,
see the speakers. Yeah.
okay, okay. Thank you, ma'am. Okay.
Yeah, now madam Anjana you can continue. Yeah.
जी मैम। जी मैम, तो वो पेशेंट मेरे पास जो चल रही है, वो मैंने बताया ना 26 एज की ग्रुप एज की है। वो लड़की है, अनमेरिड है और वो कुछ वर्क करती है, वर्किंग गर्ल है वो। और उसको मेरे पास जब आई थी, सीवियर पेन लेके आई थी, जिसमें उसको डिस्मेनोरिया बहुत ज्यादा था और इतना डिस्कम्फर्ट था कि उसकी मेंस्ट्रुएशन भी प्रोलॉन्ग रहती थी और इरेगुलर थी, इंटरमिटेंट जिसे कहते हैं, कि लगातार उसको मेंस्ट्रुएशन होता रहता था। और मेडिसिन उसने मॉडर्न की बहुत ज्यादा ले ली थी। वो सारे हार्मोनल ट्रीटमेंट और उसके अलावा जो भी पॉसिबिलिटीज होती हैं लेके आई थी। तो मैंने एक बार तो उसको बोला कि आपको जो है जाना पड़ेगा, दिल्ली जाना पड़ेगा आपके पास ही, मैंने उसके लिए बोला था। लेकिन उसने कहा नहीं मैडम मुझे ट्रीटमेंट दीजिए, मैं जॉब छोड़ना नहीं चाहती हूँ। तो मैंने उसको स्टार्ट किया था मैम, मैंने उसको बस्ती वगैरह चिकित्सा से स्टार्ट किया था। जैसे मैडम ने बताया कि अपान वायु का जो है हमें अनुलोमन करना है, तो मैंने उसको योग बस्ती दिया था। और बस्ती देने के साथ साथ मैंने उसको, हाँ मैं शेयर करूंगी आपके पास, उसमें मुझे एडवाइस भी और चाहिए थी तो आप लोगों की। तो उसको काफी रिलीफ मिला है और पेशेंट एटलीस्ट कम से कम वो अपना डेली रूटीन वर्क कर पा रही है और जॉब में वो प्रॉपरली जाती है। लेकिन अभी भी जब उसको मेंस्ट्रुएशन का स्टार्टिंग होती है, फर्स्ट या सेकंड डे, तो उसको बहुत ज्यादा पेन होता है। तो यहाँ मैंने, जैसे आपने बताया कि मात्रा वस्ती का बहुत अच्छा रोल है, क्योंकि अनमैरिड गर्ल है तो हम उसमें और कुछ बहुत नहीं कर पा रहे थे। तो मैंने उसको नाभि पूरण कराया था, अधोदर लेपन कराया था और मात्रा बस्ती कराया था। साथ में मैंने उसको नस्से भी दिया था। और मेन जो शतपुष्पा तेल की बात आपने बताई मैडम, रियली वो बहुत अच्छा इफेक्ट कर रहा है इसमें। शतपुष्पा तेल का अच्छा रोल आया। और एरंड तेल का भी मैंने इसमें नाभि पूरण और अधोदर लेपन पे लिया। और मात्रा बस्ती के लिए जैसे कई तरह की मैंने उसमें योग बस्ती में किया था। 3 या 4 महीने से इसका ट्रीटमेंट प्रॉपर चल रहा है और पेशेंट को अच्छा रिलीफ मिल रहा है। लेकिन यह है कि जहाँ तक मुझे लग रहा है, आपने कहा कि अगर ग्रेड 4 ग्रेड 5 पे जाना है तो हमें हेल्प लेनी पड़ती है लेप्रोस्कोपी सर्जरी की। तो अभी पेशेंट उसके लिए रेडी भी नहीं है। और पेशेंट थोड़ी सी कहते हैं ना, कैरियर ओरिएंटेड ज्यादा है। उसको ये लगता है कि मेरा जॉब के साथ साथ ट्रीटमेंट चलता रहे, फिर आगे की देखेंगे। तो मैंने उसको समझाया है, कॉम्प्लिकेशंस भी हैं उसके इनफर्टिलिटी के बहुत ज्यादा। मेरे स्टूडेंट्स भी उसके साथ काफी टच में रहते हैं, अच्छे से बिहेव करते हैं। वो रहती है, उसको लगता है कि नहीं मैडम मुझे आराम मिलेगा। लेकिन रियली ये चैलेंजिंग है, बहुत जबरदस्त है। और पेशेंट हमारे पास काफी लेट अवस्था में आते हैं, इसमें अगर वो कष्ट साध्य है, ट्रीटमेंट उसको लगता है लगातार चलेगा तो उसको रेस्ट है, आराम भी है और चाहती भी है। लेकिन ये है कि परमानेंट क्योर हम तभी कर पाएंगे जब उसको उनको सर्जरी करनी पड़ जाएगी। उसकी सारी जो मेरे पास पीडीएफ बनी हुई है, मैं शेयर करती हूँ आप लोगों के साथ उसको, और फिर आप लोग के विचार भी जानना चाहती हूँ। जी मैम, थैंक यू मैम।
जी now thank you madam, very nice your sharing. आप जो भी ट्रीटमेंट करेंगे फिर देखते हैं हम लोग, जो भी इसमें प्रोग्रेस होती है। इन अपकमिंग वेबिनार्स वी विल डिस्कस दैट योर ट्रीटमेंट प्रोटोकॉल एंड रिजल्ट. Now I would like to invite Dr. Krupa Patel if she is there. Dr. Krupa.
Yes, ma'am.
Yeah.
हेलो
हाँ
हेलो
कृपा. Yes.
यस मैम। थोड़ा सा मे बी थोड़ा वॉइस डिस्टर्बेंस होगा क्योंकि मैं बाहर हूँ। पहले तो थैंक यू सो मच फॉर इनवाइटिंग एंड कॉन्ग्रेचुलेशन वहीदा मैडम, आपका बहुत एकदम हमारा रिवीजन हो गया एंडोमेट्रोसिस का और बहुत कुछ नई चीजें भी जानने को मिली। स्पेशली द ट्रीटमेंट, वी आर नॉट यूजिंग any medicine which you have suggested. We are using totally different medicine. स्पेशली हमारे यहाँ पे चॉकलेट सिस्ट के ज्यादा पेशेंट्स आते हैं। जो इनफर्टिलिटी के लिए आते हैं उसमें चॉकलेट सिस्ट ज्यादा देखने को मिलती है। और ऐसे पेशेंट जिनको एलोपैथी डॉक्टर्स ने ऑपरेशन के लिए बोला है और उनको ऑपरेशन नहीं करवाना है, तब हमारे पास आते हैं। इससे चॉकलेट सिस्ट के पेशेंट बहुत आते हैं। जनरली हमारे गवर्नमेंट कॉलेज है और पेशेंट में कई बार ऐसे आते हैं जो अफोर्डेबल नहीं होते, तो लिमिटेड मेडिसिन से हम उनको हमें ट्रीटमेंट करनी पड़ती है। जनरली हम चॉकलेट सिस्ट के पेशेंट में पहले 1 मंथ दीपन पाचन करवाते हैं, दीपन पाचन और अनुलोमन। और उसके बाद दीपन पाचन के लिए हम चित्रकादि वटी, लशुनादि वटी, हिंगवाष्टक और गोदंती भस्म का कॉम्बिनेशन ये देते हैं। और उसके बाद हम उनको शिफ्ट करते हैं लेखन बस्ती पे। 8 दिन की लेखन बस्ती लेते हैं, जिसमें पहले दिन अनुवासन बस्ती होती है। महानारायण तेल हमारे यहाँ अवेलेबल है तो महानारायण तेल से, और कभी कभी दशमूल तेल अवेलेबल होता है तो दशमूल तेल से। फिर उनको शिफ्ट करते हैं 6 दिन के लिए लेखन बस्ती, जिसमें हम यूज करते हैं मध, सेंधव, यवक्षार, गोमूत्र। फ्रेश गोमूत्र मिल जाता है, अगर गोमूत्र नहीं मिलता है तो गोमूत्र अर्क, उसको फिर डाइल्यूट कर देते हैं पानी के साथ। और दशमूल क्वार्थ, बस्ती अपना मदन फल वाला जो बस्ती कल्क है वो बस्ती कल्क रूटीन जो आस्थापन बनाते हैं पर उसमें यवक्षार और गोमूत्र डाल के लेखन बस्ती 6 दिन तक कंटिन्यू देते हैं। और फिर वापस 2 दिन अनुवासन बस्ती देकर ये ऐसे 3 महीने तक हम उनको लेखन बस्ती देते हैं। 8 दिन के लिए 3 महीने, एवरी टाइम मेंसेस के बाद। लेकिन इसके साथ जो मुझे लगता है सबसे ज्यादा काम करता है वो है वालू का स्वेट। हम पेशेंट को पेल्विक रीजन में और बैक रीजन में, अपना जो अपान वायु का जो क्षेत्र है पर्टिकुलरली पेल्विक रीजन और बैक, वहां पे दिन में 3 बार कम से कम 7 से 10 मिनट तक भालू का स्वेट का करने के लिए कहते हैं। ये जो ट्रीटमेंट है पूरी 4 या 5 महीने तक ये कंटिन्यू करवाते हैं। और सबसे पहले पेशेंट को बोल ही देते हैं कि कम से कम इतना टाइम लगेगा, 3 से 4 महीने तक। और हमने देखा है कि चॉकलेट से रिजोल्व हुई है, काफी सिस्ट कम, साइज कम हो गई है, डिस्मेनोरिया ऑलमोस्ट फ्रॉम द 2nd मंथ बहुत कम हो गया है। तो ये हमें लेखन हमने आज तक एंडोमेट्रियोसिस में पर्टिकुलरली चॉकलेट सिस्ट में एक भी पेशेंट में उत्तर बस्ती नहीं की है। सिर्फ इतने से ही इंटरनल ये और लेखन बस्ती से ही हमको इतना रिजल्ट मिला है। लेकिन आज ये बात जानने को मिली है कि उत्तर बस्ती भी कर सकते हैं, तो हम अपने नेक्स्ट पेशेंट में अभी ये भी करके देखेंगे। लेकिन मुझे सबसे ज्यादा जो रिजल्ट मिला है वो वालू का स्वेट का मिला है, कि वालू का स्वेट से पेशेंट को पेन रिलीफ बहुत अच्छा मिलता है। ड्यूरिंग मेंसेस भी हम बोलते हैं, लेकिन पेल्विक रीजन में नहीं करना है, तब सिर्फ साइड में और बैक रीजन में करने को बोलते हैं। तो उससे पेन रिलीफ भी अच्छा ऐसे मिला है। और जो साइज है चॉकलेट सिस्ट की वो काफी कम हुई है। और रिकरेंस तो हमें आज तक एक भी पेशेंट में नहीं मिला है जो जनरली लेके आते हैं। तो ये एक मेरा अच्छा खासा ये एंडोमेट्रियोसिस में पर्टिकुलरली चॉकलेट सिस्ट में ये हमारे यहाँ मुझे ये 2, 3, 4 पेशेंट में ऐसे रिजल्ट मिले हैं। तो ये काफी इंकरेजिंग है। लेकिन आपका जो उत्तर बस्ती वाला जो कॉन्सेप्ट है और योनि प्रक्षालन वाला, पिचू वाला, वो मैं पक्का अपने नेक्स्ट पेशेंट में ये करके देखूंगी। तो these are my experience for endometriosis.
Thank you, Dr. Krupa. You are always nice orator and nice sharing of your cases. मैडम ने जो बोला उत्तर बस्ती सिर्फ 8 ड्रॉप्स, उन्होंने बोला कि 8 ड्रॉप से ज्यादा हम नहीं लेते हैं। वो यही उनका कंसेप्ट है कि एंडोमेट्रियोसिस जो रहता है दैट इज रेट्रोग्रेड मेंस्ट्रुएशन अगर हम लेते हैं या ट्रिम का, हाँ वो बाहर गया, तो अगर हम 8 ड्रॉप्स देते तो जस्ट वहाँ लोकल इफेक्ट ही आएगा, उससे आगे वो आपका जो मेडिसिन नहीं जाएगा। ये भी थोड़ा ध्यान रख के मुझे लगता है इसमें उत्तर बस्ती देनी चाहिए। अदरवाइज एंडोमेट्रियोसिस में हम लोग जैसे तुमने बोला हम नहीं देते हैं, बट मैडम का अपना एक्सपीरियंस है तो वी कैन ऑल्सो ट्राई with 8 drops only. Yes, that is nice concept madam has shared. Now I would like to invite Dr. Pushpa Yadav.
मैडम एक ये भी जो मैडम ने भी बताया था नाभि पूरण, ये हमने अभी अभी स्टार्ट किया है। नाभि पूरण का भी मैडम बहुत अच्छा और बहुत मिरेकल मतलब मैजिकल रिजल्ट मिला है। कई पेशेंट को सिर्फ नाभि पूरण करवाया, हमने तो सिर्फ घी से स्टार्ट करवाया और सिर्फ घी से नाभि पूरण करवाया। कहीं कहीं में हिंग भी डलवाई कि हिंग मिला के नाभि पूरण और नाभि लेपन कीजिए, तो उससे भी उनका काफी सारा पेन कम हुआ है। तो ये भी एक मिरेकल रिजल्ट मिला है इसमें पेन कम करने में।
यस, नाइस नाइस। नाभि पूरण भी एक अच्छा कंसेप्ट है। जो हींग वाला जो तुम बता रही पेस्ट, वो तो हमारा पुराना बोल सकते हैं कि हम यहाँ हमारा कल्चरल जो बोल सकते हैं कि जो लोगों में प्रचलित है पहले से ही, जो हम नाभि पे जो लगाते हैं हिंग का पेस्ट वो है, लेकिन ये नाभि पूरण जो है वो थोड़ा सा अलग कंसेप्ट आता है कि हाँ, पर लेकिन उसमें हमें पेशेंट को सिखाना पड़ता है कि हाँ इतना तुम घर पे
Yes,
कर लीजिए, है ना। यस
yes,
यस,
yes.
तो उसका भी मतलब पर्पस तो इन सबका यही है ना कि वायु का शमन करना, अनुलोमन करना है और शमन करना है। पूरण से हम स्नेहन कर रहे हैं, तुमने जो वालु का स्वेद बताया उससे हम वायु के शीत गुण से विरुद्ध जाकर उसमें उष्णता करके तो वायु का शमन कर रहे हैं, वायु को कंट्रोल कर रहे हैं। इस प्रकार से वायु के ऊपर काम करके तो हम उसको इस व्याधि से पेशेंट को हम रिलीफ दे रहे हैं। नाउ पुष्पा यादव मैडम अगर हैं तो मैं उनको भी चाहूंगी कि अपना
Good,
कुछ शेयर करें अपना एक्सपीरियंस। यस
good
डॉक्टर
evening,
पुष्पा,
ma'am.
गुड
Good
इवनिंग,
evening, ma'am.
वेलकम।
एक्चुअली मैं एक मेरा थोड़ा सा मिस हुआ था दैट फ्लावर एएमएच जो इम्प्रूव करने के लिए
आवाज क्लियर नहीं है, थोड़ा सा
रही थी,
नेटवर्क एरिया में आइए।
जो आई था, तो मैं एक बार उसके बारे में जानना चाहती
डॉक्टर पुष्पा आवाज क्लियर नहीं आई आपकी।
थोड़ा सा आपने। हाँ जी, एक थोड़ा देर मैंने लेडी थी और शी वाज इनफर्टिलिटी केस, और उसके बाद शी वाज हैविंग फाइब्रॉइड यूट्रस विद एडहेजन्स एंड उसमें मैंने क्षार तेल और दशमूल का पहले शोधन किया, फिर क्षार तेल का बस्ती में और था बला तेल, दोनों का, लेकिन वो प्रीवियस टाइम उसको कोई सिम्टम नहीं था। तो क्या ऐसे हम रिस्क ले सकते हैं?
डॉक्टर पुष्पा आपकी आवाज बीच बीच में कटी है, तो मुझे कुछ ज्यादा सुना ही नहीं दिया इसमें प्रॉपर कि आप
एक्चुअली मैं
क्वेश्चन पूछ
एक तो
रहे हैं।
मैम ने एएमएच के लिए बताया था ना, मुझे मेरा वो थोड़ा मिस हो गया था। नेटवर्क इश्यू बहुत ज्यादा है यहाँ, पुअर नेटवर्क हो रहा है आज,
हाँ नेटवर्क इश्यू
मे
है।
बी ड्यू टू दिवाली। जो वाइट फ्लावर्स से दिखाते थे तो मेरा मिस हो गया था कि एएमएच के लिए, एंड आई वाज कंसर्न कि पूछूं क्या था वो जो
अच्छा
एएमएच
मैडम,
इम्प्रूव करने
हाँ
के लिए मैम ने बताया
पूछना
था
चाह रही हैं, ठीक है मैडम।
एंडोमेट्रियोसिस के
वहीदा,
साथ।
वहीदा मैडम।
Oh, okay, ma'am, it is not clearly heard.
She is asking about you have thrown light upon low AMH and endometriosis. What is the relation of low AMH with endometriosis, and what can be the management in the such type of cases? That is her question, and that is also another question from other participants also. So you can throw light upon that again.
Okay.
Yeah.
And in endometriosis and adenomyosis, there is low AMH we are seeing with the patients, because I think due to the endometriosis, there is prostaglandin secretions and also all the other hormonal imbalance, etc. The ovarian reserve is reducing. That is, and also there is so much inflammations are there. That is why there is low AMH value. That is the fertility of the patient is reducing, and the AMH is the fertility reserve. It is reducing in endometriosis and adenomyosis. In this condition, after treatment, giving with the Nirgundia, Gobijana, etc., that is the endometriosis management, we can add some medicine for the improvement of AMH level. With the Shadapushpa, etc. That is, Shadapushpa is one of the main ingredient for improving the low ovarian reserve and also low AMH, etc. In Shadapushpa, it is clearly said that Rajo Nivritti Nancha Putrada. While attaining Rajo Nivritti, there is reducing in AMH, reduction in all hormone level, etc. And that is that is addressed with this Shadapushpa Churna. That is why I told that the Shadapushpa is very good for improving the AMH value. In endometriosis and adenomyosis condition, there is decrease in the AMH level, and in PCOS condition, there is increase in the AMH level. While increasing or decreasing in the from a particular, that is the optimal level. If it is increasing, it is denotes ovarian tumor or PCOS, etc. If it is decreased, and it is denotes low fertility. So we have to maintain keep, and that is optimal level of AMH with our medication. And this after giving the proper shodhana or shamana therapy of endometriosis like Nirgundyadi, Gobiandanadi, Sukumara, Hingatrona, etc. for 3 months, then we can do some preparatory medicines or the pre-conception medicine for that patients with the Garbhashya Shodhana Kashaya and also with the Shadapushpa for improving the AMH value.
Yeah, thank you, madam. One more question is there in chat box, that is use of menstrual cup is increasing nowadays in girls, and you have said that it is having relation with endometriosis. So they want
Yes.
the again some more understanding about that causative factor. Yeah.
And the second question, madam?
Same question. Do you elaborate that how menstrual cup is increasing the incidence of endometriosis?
Okay.
That they want to understand. Yeah.
Okay, that is nowadays there are the use of menstrual cup is in increasing manner, and the patient is also coming with the endometriosis and adenomyosis after 6 months or 7 months use of menstrual cup, or after 1 year use of menstrual cup. There is severe in previous there is no dysmenorrhea, etc. But nowadays there is severe congestive dysmenorrhea like that. In all the cases, we while taking history, and they are saying they said that they are using a menstrual cup for menstruation. It is practically it is very effective for the time being for menstruation, but I think when we put the menstrual cup inside the vagina, there is some relation with the menstrual blood and the cervix. We all know that is the cervix and pushed up the menstrual blood, and it after it the vagina also pushed the menstrual blood to the external surface, but we are obstructing that the means normal annulomana. Just we are keeping something in the vagina, and it will cause the close contact of menstrual blood with the cervix for more hours, and it will cause some cervical hostility or inflammation there. And also while taking the menstrual cup externally, that is from inside the vagina, while taking it externally, there may be some vacuum creation, that is that pressure will cause retrograde going of the menstrual blood into the cervix, uterus, or if the pressure is more, it will get to the fallopian tube, etc. That retrograde menstruation is one of the cause for endometriosis. That is retrograde menstruation theory. That is sudden removing of the panties also there is a cause. Then and the removing of the endometrious menstrual means the menstrual cup may be the main cause for this type of retrograde menstruation. That is why the amount of adenomyosis and endometriosis more in patients with who are using menstrual cup. And now we are advised to stop the use of menstrual cup. Then with giving medicine, the symptoms are reducing fastly.
Yeah, yes, nicely elaborated, madam. That the menstrual cup is there, so the same time the blood is there for more time. And
Yes.
there are chances of that, yeah, there are chances of that absorption or retrograde menstruation that female.
Yes.
When there is liquid available over there, that it can be absorbed or it can be go back. That is, I think, a mechanical process of this endometriosis. You explain like that. No? Right,
Yes.
ma'am? Yeah. And one more one doubt was that you have explained about parity. Is there any relation of priming nulliparous female or multigravida?
Ma'am, once more.
Yeah, in causative factors, that was it was mentioned that it is more common in multiparity.
Multiparity more common is adenomyosis, not the endometriosis.
Yeah. Okay.
Adenomyosis, that is in differential diagnosis of endometriosis. The adenomyosis is also one thing having same symptoms, but endometriosis normally seen in the reproductive age, but in adenomyosis is commonly seen in the multiparity level. That is.
Yeah, it was mentioned in differential diagnosis, right?
Yes.
Yes. In differential diagnosis, we can differentiate that the patient is having pain. She may have adenomyosis
Yes.
if she is multipara. By clinical presentation, also we can identify that patient is multipara. She is having pain. There are chances for adenomyosis instead of endometriosis.
Yes.
Right. Such way we can do differential diagnosis in such type of patients.
Yes,
Nice.
in such type of cases with adenomyosis, etc., we can treat the patients with that is the Bela Kodutuvadi Kashaya said in the Sudiga Jara, because no adenomyosis there is the uterus is in a glandular shape or in the bulky uterus. Most of the adenomyosis is bulky uterus with glands inside. Then rather than the Nirgundyadi Kashaya or Sugumaran Kashaya, etc., we can use the Bela Kodituvadi Kashaya. It is said in Sahasra Yoga, it is a Malayalam yoga. That is Bela Kodituva Saparpadabdha Dhanyaga Mudgam Cherupanjamulam Sasringiveram, taking in the early morning. That is Bela Kodituva means Ananda, Parpada, Abda, Dhanyaga, Mudga, Cherupanjamula. These are the drug, and it is a good drug of choice for the bulky uterus, because normal bulkiness of the uterus is found in postnatal period, that is on the Sudiga Kala, and it is said in the Sudiga Jora Chikitsa, that is in Sudiga Kala, for alleviating Sudiga Jora, this Bela Kodutuvadi Kashaya is better. Then we are taking this Bela Kodutuvadi Kashaya along with Chandraprabha. It is a good pelvic decongestion medicine. That is a Chandraprabha medicine, Chandraprabha Guliga. So Bela Kodutuvadi with Chandraprabha, then Sugumaran Kashaya with Hingutriguna, etc. we can use for the management of adenomyosis rather than Nirgundyadi, Gobidhandradi, etc.
Yes, madam. If we think like that, if we are thinking the pathogenesis in relation to Sutika Jwara, then we can think about Devdarvedi Kashaya also, right? Devdarvedi Kwath. Yeah, Devdarvedi Kashaya is also mentioned in postnatal cases, and it can also give result in adenomyosis cases, and we have used in such type of cases.
Yes, ma'am. It is. I think it is available there more, and here we are available with this medicine. That is why.
Yeah, right. Nice.
That is.
Now I would like to invite. Yes, ma'am.
In our chikitsa, it is mentioned as the patient Kasminam Deshe Jadaha Samruddho Vyadidova Tasmincha Deshe Manishyanam Idam Maharajadam Idam Viharajadam Edavat Balam Edavat Daushada, etc. It is considering. Okay, ma'am. Thank you.
Nice. Yes. Right. Now I would like to invite if Dr. Anjali is there, if she want to share any case. Anjali? She's not there, I think so. Yeah. Ramveer sir, आप अपना एक्सपर्ट ओपिनियन दीजिए अभी.
यस मैम, थोड़ा सा यहाँ पर नेटवर्क का प्रॉब्लम हो सकता है, फिर भी मैं अपना
सर आवाज नहीं आ रही. आप वीडियो ऑफ करके बात करेंगे तो शायद मुझे लगता है आवाज आएगी.
Of this network issue.
हाँ, सब लोग आज फेस्टिवल की वजह से बाहर है ना, तो यही दिक्कत है.
हेलो,
बाहर. हाँ
मैम आवाज आ रही है क्या?
जी सर, अभी आ रही है. नहीं आ रही है सर. सर थोड़ा नेटवर्क में आइए या वीडियो ऑफ करिए तो आएगा आवाज.
अपनी बात मेडिसिन
जी सर, नेटवर्क में आते हैं, तब तक अगर कोई अपना और ओपिनियन देना चाहे, डॉक्टर राजकरिंती, डॉक्टर लीजिमा।
हेलो, नमस्ते
हाँ नमस्ते।
मैं भी आज चॉकलेट सिस्टर से रिलेटेड एक केस शेयर करना चाहती हूँ। एक क्या, वैसे तो 10-15 केसेस है मैम। चॉकलेट सिस्ट
हाँ,
में
तुम्हारे
मेरा
केसेस
जो
मुझे मालूम है, काफी सक्सेसफुल रहते हैं, तो आई वांट कि तुम कुछ शेयर करो क्या।
हाँ मैम, एक्चुअली मैं भी बाहर ही आई हुई थी अभी, गेस्ट मतलब। फिर भी मैं शेयर करती हूँ। अभी भी आई थी मई जून के आसपास। उसको भी 7 सेंटीमीटर की चॉकलेट सिस्ट थी मैम। प्रोटोकॉल मेरा लगभग थोड़ा बहुत वेरिएशन होता है, लगभग सेम ही रहता है। तो उस पेशेंट में मैंने विरेचन नहीं कराया था मैंने षडंग पानी की योग बस्ती दी थी मैम उसको। सीधा षडंग पानी का कषाय बना के और उसमें यष्टि मधु तेल और दशमूल तेल साथ में ऐड किया था। तो 10 डेज की मैंने उसको योग बस्ती फॉर्म में दिया। उसके बाद उसको मेडिसिन में मैं काचनार गुगलू गोरखमुंडी को के साथ देती हूँ हमेशा। और एक नई मेडिसिन
तुम्हारा भी नेटवर्क गया।
Network issue is more, I think.
हम्म, नहीं आ रही आवाज राजकरिंती। Oh, lot many network issues today due to festivals. I think so. So now ऐसा है ना, सर का दूसरा वेबिनार का टाइम भी हो गया है, तो पवन सर।
ये मेरा 10 बजे से है, आपके डर से 10 बजे रखा है मैंने, चिंता मत कीजिए।
अच्छा, मुझे लगा 9:30 है आपका।
नहीं नहीं, वो अब मैंने वचन दिया है
आप मुझे मुझे बोल रहे हैं आपके डर से। मेरा डर।
क्योंकि मैं जानता हूँ स्पीकर बड़ा प्यारा बोलते हैं, ज्ञान की चर्चा होती है, तो उसको रोकने का मेरा कहीं मन नहीं होता।
ठीक है, फिर हम चर्चा चालू रखते हैं। डॉक्टर राजकरिंती, अगर तुम नेटवर्क एरिया में आ रही हो तो बोल सकती
हाँ
हो।
जी। जी मैम,
जी
कंटिन्यू करूँ?
हाँ हाँ, तुम्हारी आवाज चली गई, तब बोलो, अभी तुम बोलो।
अच्छा।
हम्म,
जी
सर
जी
ने
जी
टाइम दे
मैम।
दिया है।
जी मैम। तो मैम उस पेशेंट को ओनली मतलब 26 डेज ही हुए थे, तो उसने यूपीटी किया तो स्ट्रांगली पॉजिटिव आया। फिर वो बोली कि मैम मुझे
बट
शॉर्ट नहीं हो
तुम्हारा
रहा है तो।
ट्रीटमेंट किसी ने सुना नहीं, तुम्हारा आवाज नहीं आई थी।
ओके
हाँ,
ओके मैम, ट्रीटमेंट में दोबारा रिपीट करती हूँ। लगभग तो मैं सभी पेशेंट में जैसे अलग अलग होता है, बट कुछ में कॉमन होता है। तो जैसे एडिनोमायोसिस के लिए भी मैम बोल रहे थे, तो एडिनोमायोसिस और चॉकलेट सिस्ट में जिन पेशेंट में सीवियर पेन होता है और ब्लीडिंग भी ज्यादा होती है, तो मैं षडंग पानी कषाय की बस्ती देती हूँ उनमें। विरेचन तो कराती थी, पर अब विरेचन वाला थोड़ा लंबा प्रोटोकॉल जो बाहर वाले पेशेंट है वो अफोर्ड नहीं कर पाते हैं। तो फिर मैंने उनको लेखन बस्ती, वो षडंग पानी की लेखन बस्ती कराई 10 डेज के लिए। और उसके बाद मेडिसिन में जो है काचनार गोरखमुंडी क्वाथ ये स्टार्ट रखा। और आयुकल्प की जो मेडिसिन आती है साइटोक्रोल 80 1 OD देती हूँ ओनली। तो ये जो मेडिसिन मैंने दी उस पेशेंट को कंटिन्यू 3 महीने दी। 3 महीने के बाद अभी ओनली उसको मतलब पीरियड्स आने में 25th डे ही हुए थे कि आने वाले हैं, तो पेशेंट का कॉल आया कि मैडम मुझे ऐसी फीलिंग हो रही है कि मैं प्रेग्नेंट हूँ। तो मैंने कहा इतनी जल्दी तो कैसे पॉसिबल है। उसको स्ट्रांगली पॉजिटिव आया। उसके बाद फिर वो बोली कि अभी भी विश्वास नहीं हो रहा है कि मैं प्रेगनेंसी हो सकती है। तो फिर हमने उसका बीटा एचसीजी कराया, तो वो 25th डे पे उसका 2600 समथिंग आया, मतलब काफी अच्छा लेवल था। स्कैन कराया, यूएससी कराना नहीं था, फिर भी मैडम बोले वो रेडियोलॉजिस्ट की करवा के देख लो। करवाया तो फिर उसको सेक भी बन चुका है, योग सेक जेस्टेशन सेक बहुत अच्छे से डेवलप हुआ है, वो खुद भी सरप्राइज थे। फिर मैंने उसको कंसल्ट के लिए एलोपैथी डॉक्टर्स के पास भेजा कि भाई प्रेग्नेंट है और ऐसा स्पेशल केस है तो भेजते हैं। तो वो सब भी बड़े शौक थे कि इतनी जल्दी इतना अच्छा इंप्रूवमेंट कैसे हो सकता है। तो पेशेंट बोलता है कि मैं तो आयुर्वेदिक मेडिसिन ले रही हूँ मैडम, मुझे नहीं पता, जो किया है मैडम ने किया है। तो कहने का मतलब ये है मैडम कि हम अपनी मेडिसिन पे अगर ट्रस्ट करके ये देते हैं ना, और कुछ मेडिसिन अपनी बहुत अच्छा काम करती है। ये नया मेरे को मिला है फॉर्मूला, जो साइटोक्रोल वाली मेडिसिन है, आयुकल्प की आती है मैम, आप भी कभी यूज करके देखिए, इसमें बहुत अच्छा रिजल्ट मिलता है। पीसीओडी हुआ, सिस्ट हुआ, फाइब्रोइड हुआ, इन सारे केसेस में ये मैं देती हूँ। और बाकी गोरखमुंडी को आत और काचनार गुगलू का तो है ही, सही रिसर्च हुई है अपने जामनगर में भी। और षडंग पानी भी मैं अब एड करने लगी हूँ मैम। एक इससे पहले मैंने अपनी प्रेजेंटेशन में भी शेयर किया था मैम, वो 34 ईयर्स की गर्ल थी। हेलो, आवाज आ रही है मैम मेरी?
हाँ हाँ, सुन रहे
हाँ।
हम्म,
तो वो सोनिका वाला केस किया था मैं, वो भी अभी कंप्लीटली ठीक है मैम, मतलब उसको 15 सेंटीमीटर की सिस्ट
अच्छा,
थी।
वो ठीक है अभी? ये रहा,
हाँ,
नाइस
पूरी
नाइस।
तरह से ठीक है मैम, अभी उसको कोई मेडिसिन नहीं चल रही है, पीरियड्स भी रेगुलर है, सब कुछ सही है उसको। और चॉकलेट सिस्ट वाले मैम अब तक मेरे कम से कम 20 केसेस जो है कंसीव कर चुके हैं। अब मैं उनका डॉक्यूमेंटेशन भी रखने लगी हूँ।
वेरी नाइस नाइस नाइस।
जी मैम।
बहुत अच्छे, वेरी नाइस।
थैंक
और
यू सो
उसमें तुम्हारा
मच।
जो षडंग पानी वाला कंसेप्ट है ना, वो अगर हम देखें दोषिक प्रीडोमिनेंस के हिसाब से, अगर हमें पित्त दृष्टि के हिसाब से मिलता है तो पित्त शमन वो करता है पेशेंट को
जी जी
वायु
मैम,
के
कषाय
साथ।
पित्त ड्रग पे, जी जी
हाँ,
मैम,
तब
इसमें कषाय
जाके उसमें
पित्त।
हमें रिजल्ट मिलता है उन केसेस में। या
जी मैम,
बहुत
और मैं
अच्छा ये
बनवाती हूँ।
तुमने ऐड किया है।
जी
हम्म।
मैम, मैं षडंग पानी बनवाती हूँ ना, तो उसमें शुंठी हटवा देती हूँ, मैं 5 ड्रग्स ही रखवाती हूँ। अगर कहीं जैसे
यस।
हमें कफ वाला लगता है तो शुंठी ऐड करवाती हूँ, बाकी लगभग पित्त वाले रहते हैं, चॉकलेट सिस्ट के सारे केसेस अपने पित्त डोमिनेंसी वाले होते हैं। तो उस कंडीशन में मैं शुंठी हटवा देती हूँ। बाकी उसका किसी में ज्यादा सीवियर कंडीशन है, ब्लीडिंग हो रही है, तो फिर मैं उसका शीरपाक करवा के देती हूँ मैम।
गुड। हाँ, मतलब ऐसे पेशेंट के हिसाब से हम इनको
हाँ, वेरी
कस्टमाइज
कर
कर
लेते
सकते हैं ट्रीटमेंट
हैं।
को, तभी हमें फायदा मिलता है। अदरवाइज एक कोई फॉर्मूला नहीं होता है कि हाँ इसमें ये फॉर्मूला, इसमें वो फॉर्मूला। जब तक
यस
आप
मैम।
पेशेंट को नहीं समझते उसके हिसाब से ट्रीटमेंट में थोड़ा सा चेंज नहीं कर सकते। नहीं करते
हाँ
तो नहीं मिलता रिजल्ट, करते हैं
जी
तो
मैम।
तुरंत हमें मिल सकता है रिजल्ट।
यस मैम,
ये
तो
लाइव
पेशेंट के,
एग्जाम्पल है
यस
तुम्हारा।
यस,
यस यस
जी
यस।
जी मैम, हर पेशेंट के अकॉर्डिंग थोड़ा थोड़ा वो चेंज कर देते हैं।
हम्म
और
हम्म
जो
हम्म
नाभि पूरण वाला मैडम बता रहे थे, इमरजेंसी मेरे पास जैसे बच्चे आते हैं ना अपने बीएमएस वाली पढ़ रहे कि मैडम भयंकर दर्द हो रहा है, पेन हो रहा है, तो सीधा दशमूल तेल से मैं तो अभ्यंग करवा के स्वेदन करवा देती हूँ पेशेंट वहीं पे ओटी
हम्म
में
हम्म,
तुरंत ही, तो पेशेंट को 10 मिनट में तुरंत ही आराम मिल जाता है। फिर भी अगर किसी को ऐसा लगता है कि हाँ, एक बच्ची थी जिसको बहुत ज्यादा नोजिया हो रहा था, मेडिसिन कुछ इनटेक कर ही नहीं पा रही थी वो उस टाइम पे, तब मैंने उसको एक अपना जो हिंकोसिड एंटासिड आता है हिमालय का, वो दिया। उसके बाद एक टेबलेट, हाँ मैम, एंडोटोन भी देती हूँ मैं जब एडेनोमाइसिस के केस होते हैं ना, चरक की आती है, बहुत अच्छी मेडिसिन है मैम। तो उससे भी तुरंत रिलीफ मिलता है, मतलब जो डाइक्लो नहीं कर पाती, जो मेप्टाल स्पास नहीं कर पाती, उससे बहुत अच्छा रिजल्ट अपने एंडोटोन का है। तो ये मेडिसिन भी मैं हर पेशेंट में ऐड करती हूँ। बाकी तो मैम केस टू केस वेरी
बहुत
करते हैं,
बढ़िया।
पर
यस यस। हाँ,
जी
बस वही केस टू केस वेरी है, उसके हिसाब से हमें ट्रीटमेंट प्रोटोकॉल अपना चेंज करना पड़ सकता है। हाँ,
जी
मतलब
मैम।
कस्टमाइज करके ही हम ट्रीट करते हैं पेशेंट्स को। वो सभी के साथ एक्सपीरियंस रहता ही रहता है, सभी ऐसा ही करते हैं, है ना?
जी जी जी
तो
मैम।
अभी नाउ आई वुड लाइक टू डॉक्टर लीजिमा इफ शी वांट टू शेयर एनी केस और हर एक्सपीरियंस। डॉक्टर लीजिमा,
नमस्ते मैम।
नमस्ते।
नमस्ते मैम, एक्चुअली तो केस एक्सपीरियंस नहीं करना, मैं शेयर करना चाहिए मुझे। एक्चुअली आई एम वेरी थैंकफुल टू डॉक्टर वाहिदा रहमान फॉर दिस टॉक। एक्चुअली शी इज वेरी फेमिलियर टू मी आल्सो, शी इज फ्रॉम केरला। एक्चुअली मैम,
हाँ,
वी हैव टू
वहीदा
थिंक
मैडम
अबाउट,
इज वेरी फेमस फॉर her treatment on
yeah, yeah,
endometriosis.
yeah, ma'am.
Yeah.
Actually, we have to think why there is increasing prevalence of endometriosis these days. We have to think on that aspect in my view,
Yes, 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 yes.
because actually
Preventive aspect.
yeah,
Hmm.
preventive aspect is to be highlighted, because nowadays we see there is high prevalence of this Vegadarana, especially urination among school going children. Actually, that is one of the main reason, I think, for this increased prevalence of this endometriosis nowadays. And the another thing is the commercial ads. They are showing the commercial ads of the sanitary pads. They are misguiding the females, because they are telling we can do anything, we can do any activity by wearing this sanitary pads during this menstruation. That is misguiding, I think, ma'am. Or
Yes,
this one,
yes,
this,
yes.
because, and this Registella pyrigeria, it should be given importance, ma'am. Actually, we are from Kerala. I haven't seen means much giving any these girls are not giving much importance to the Rajasala Parijere in Kerala, but in Jamnagar and other North Indian states, this Rajasala Parijere is given much importance. Actually, I want to ask Bhavida ma'am regarding her advice for this Rajasala Parijere for these patients, ma'am. What Rajasala Parijere ma'am has been advising to these patients or for these normal adolescent girls. And one thing ma'am highlighted about this Manasika Bhavas, those females who are having anxiety, stress, they are more prone to this endometriosis. And ma'am has also highlighted the stress management as a treatment protocol in this endometriosis. That's very nice, I think. And regarding this menstrual cup, I also had doubt whether this is to be advised or not to be advised. But ma'am has given a clear-cut view on that. Actually, this is all my opinion, ma'am.
Yes, as far as the Rajaswala Paricharya, you told, in our classics, it is mentioned not to do much movement, as you told that advertisements are misguiding and like
Yeah,
that.
yeah.
So movement, yes, movement also create Vata Prakop. है ना? Due to Vat Prakop, there can be Pratiloman. That is the
Yeah.
causative factor. कि in past time, I remember that our parents or our grandparents were not doing work during those days. They were sitting separate and taking rest like that. That was the custom in India. But now nobody is taking rest or nobody is having like that कि हम rest करें और काम छोड़ दें, ऐसा कोई भी नहीं होता है. But it is, I think, should be encouraged. You told like that. And in some countries, they have started to give menstrual leave to the girls and females. In offices also, they have started. Official, they have initiated this type of rules. And
Yes,
this
ma'am.
also can be encouraged, and this can be forwarded to the government or other organizations also, that Rajaswala Paricharya and rest during those period is must. Not to do lot many work or exercises and like that movement to control Vata dosh. That can be encouraged, I think. And we can ask Madam Wahida also to say
Yeah,
something
yeah.
about that. Yeah,
This Rajaswala
Madam
Paricharya.
Wahida, you can share your opinion regarding Rajaswala Paricharya and movement during the menstruation days.
Yes, ma'am. And coming to the Rajaswala Paricharya, in our classic it is said that Tadaha Pushpakshanadeva Kalyanatrayini Trahyam Vrija Alankara Rahida Darbha Samstara Shayini Chairegam Yavagam Stogam Kostashodhana Karshanam Parnesharavai Hasteva Bhunjida Brahmacharini. It's a good measures for not to have any diseases further for the reproductive age and the like endometriosis or adenomyosis, etc. During the Rajaswala period, if we are doing vigorous work and also if our mental factors are more distorted, it is a very essential cause for the endometriosis, etc. And as Dr. Lijima said that, and the sanitary pad makers, they said while we wearing this pad, we can do dancing, we can do anything, and also we can overnight pad, or we can use this for more than 8 hours, 9 hours, etc. Please advise proper Rajaswala Paricharya to the adolescent girls to prevent adenomyosis and especially endometriosis. That is the use of sanitary pads, even if there is bleeding or not, only up to 6 hours, and after 6 hours should be changed. And please don't use more chemical pad, that is the pad having extra absorbent gel, more absorbent gel, that is the combination of chemical which cause the absorption of blood, and that chemical, the blood combination and close relation with the external genitalia will also cause some infections and other problems. And also the dancing or the strenuous work at that period. That is why in early period there is some separation for the from the normal work. It is not abandon the patient ladies for with the work, but some rest is needed. And also Kalyanatrayini, Acharya clearly said that Kalyanatrayini, that is don't have any tension, only think good thing and good mental peace. In peace factor, that is Trahyam, she should go to rest for the this rest is necessary for her body and her the systems, etc. That is a good thing for keeping the lady healthy for the future life. That is the Rajaswala Paricharyam. And the use of menstrual cup, I explained earlier, it will cause some this retrograde menstruation and abana pradiloma ruba raja pravartana and cause endometriosis and adenomyosis. So now I clearly motivate the patients for using menstrual club, etc. That's my opinion, ma'am.
Yes, nicely explained, madam. And one query was from my side that once you mentioned that Gopi Chandana tablet.
Yes. Gopi
Yeah.
Chandana tablet with the Nirgundyadi Kashaya, because I think in my clinical practice, the Gopi Chandana is a good antimicrobial tablet. Rather than using in endometriosis, etc., we can use in Jora-like condition for the babies or the children, etc., and also in the Amavada condition of the adult patients or the Amavada Pragarana, etc. It's a good antimicrobial, and in recurrent tonsillitis also we can use Gopi Chandana. So I incorporate Gopi Chandana with Nirgundyadi because this initially the endometriosis there is inflammation. For preventing deteriorating the inflammation, we use Nirgundyadi with Gopi Chandana. It's good anti-inflammatory and because we see on most of the endometriosis case with intermittent fever or intermittent fever in the menstruation or ovulation and menstruation, etc. So along with Nirgundyadi or Gopi Chandana, this also reduced, and the feverish like condition also reduced. That is why I use, mom.
Okay, very nice. That was new for me, Gopi Chandana tablet in the cases of endometriosis. Nice, madam. Nice.
Thank you, mom. Here also severe rain, etc. So the voice is breaking sometimes. That is why some in between sometimes there is so much some sound in between the voice. The voice is not clear. Not I think how my voice is audible, ma'am. Oh.
Yes, very clear. Your voice is very clear. No doubt about any network in your presentation. Yeah.
Okay. And here in our legislature, it is said that Alangara Rahida, and also it is said in that Smrija Rahida, not Snana Rahida. In some of the people, they explain that is they missing that part that Ayurveda it says there is no snana. There is no snana. It is not says as Snana Rahida. It is says as Mrija Rahida. That is snana means just wash off our body, etc. It is allowed. But Mrija means application of oil on the head and more times of liquid or the water in the head. That is, this Nana will cause stambhana. That is, it will cause stambhana of the rajas. That is not the proper pravartana of abana vayu or the artava rajas. That is why Acharya says that mrija alangar rahida. That is mrija rahida. It is not snana rahida. Artava Asamaya, that is the Ridu period, should be keeping a good clean measures, etc. So Snana is allowed, Mrija Rahida is Acharya says, and also the Alangara Rahida, like Anjana, etc. In our classes, it is also said that Anjana, the Andaha, that is when we are applying Anjana on the eyes, etc., it will cause some effect on the formation of the next of offsprings or the next bija, like that. I think it is very related with the chromosomal anomaly or like that because the Anjana Nasya during that menstruation period is contraindicated. That is why the Acharya says Mrija Alangara Rahida Dharva Samstara Shayini for the proper rest. And with the small Dharva is also good for the alleviating pain, etc. And also there is some something with the our Rudumati Charya, that is it is should be in the Brahmacharya 3 days of menstruation or the menstrual date should be observing brahmacharya is must, because the vaginal pH is also less at that condition. If there is any coitus, it will cause also the upward movement of the rajas and also the increase infection, etc. So the brahmacharya is also essential at that period to prevent the endometriosis, etc. In some cases, that is the newly married couple, they think that there is no pregnancy for sometimes for more than 1 year, etc. They observe intercourse at the safe period, at a safe just after menstruation or just before menstruation, there is safe period. But at both this time, there is the decrease of the vaginal pH may cause increase in the infection and also cause increase in the upward movement of the raja, will cause endometriosis and adenomyosis or infection, etc.
Yes, madam, nice. And one thing in Rajaswala Paricharya, it is mentioned that Shirasnata is not advisable. Shiraska Snana.
Yes.
Head wash. Yeah.
Yes.
Head wash is not indicated. If she do head wash, then the menstruation will stop.
Yes, while using oil over the shiras and doing more shida water in the shiras, it will cause the stambhana and it will cause the rajas stambhana also. That is the proper outflow of the menstruation will stop. That will cause some abana vaigunya. It may cause some reproductive disorders later. That is why Mrija Rahida is advocated in our classics.
Yes, madam. If we think like that, so now previously it was custom that head wash should be done with a gap.
Yes.
Nowadays, almost daily girls are doing head wash.
Yes, yes.
Yeah, that can also be one causative factor.
Yes. And also in the treatment of endometriosis, the mind factor, that is the stress factor, anxiety, etc. should be addressed well, because the Ayurveda doctors can do the Dhidhairyatmadi Vijnana. Any other doctors in the conventional medicine, they treat the patients along with the symptoms. For the symptoms, they are giving some painkillers or some symptomatic relief to the patient. But we Ayurveda doctors, we know the patient well, and we have to teach the patient, and we have to go in depth to the patient. That is Pradipa Buddham Shastram. We have Adurasya Andaratmanam Jnana Buddhi Pradibena Yona Vishadi Yogiva Dadurasya Andaratmanam Sajarogam Chigilsadi. So we have to enter the patient's Andaratmana with with our Jnana and Buddhi, and share the Dhairyatmadi Vijnana to that patient. Then only our treatment works in a magical manner. That is, it will work more, and there is more result with the with that type of treatment. And also advise the patient to come on after the menstruation of in each cycle to palpate the patient, to pacify the patient, to palpate the patient, to measure the amount of pain, amount of congestion, etc. in the lower abdomen, etc. We can interrogate the patient, we can palpate the patient, we can see whether there is the increase in the size of the chocolate cyst or the endometriosis cyst, etc. or whether there is decrease. Every month there is no ultrasound is advisable. So we can see the patient, and we can palpate the patient, and we can assure the patient with our medicines, etc. And also, and some patients are complaining like that they are using so much methotrexate or so much other drugs for preventing that is the painkillers. And even if the patients can use some deflazacort like steroid medicine to stop the pain, but there is no effect for the pain. And also they are using some suppositories in the rectum also for alleviating the pain, etc. That much severe pain they are observing with the endometriosis and adenomyosis. But with our classical treatment, it can reduce without any painkillers. Reduce, it means the Ruk Pradikriya is the chikitsa, where when the pain is reducing, the endometriosis is reducing. The medicine is acting on that cause and the disease. It is very much effective measures in Ayurveda only. That is, ma'am.
Yes, yes, very nice, nice. Thank you, madam. Now, if anyone has question, then we can take the question. Otherwise, we can wind up this session, sir. Anybody, if want to ask any question? Okay, then, Pawan sir.
हरिओम जी, हरिओम।
जी, अग्निहोत्री सर तो है नहीं है, तो वाइंड अप के लिए या कंक्लूडिंग रिमार्क्स के लिए
रामवीर जी नहीं है?
रामवीर जी का कनेक्शन नहीं थे, वो बाहर थे, तो वो भी नहीं ज्वाइन कर पा रहे हैं। हाँ, थोड़ा कनेक्शन इश्यू आज बहुत आ रहा है फेस्टिवल की वजह से।
मैं आदरणीय प्रोफेसर सुहास कुमार शेट्टी का स्वागत करता हूं। वेबिनार 5-7 मिनट में हम शुरू कर रहे हैं। हैप्पी कर्नाटक डे। तो इट वाज यस्टरडे एंड प्रोफेसर लक्ष्मीकांत द्विवेदी सर को इसके उपसंहार के लिए मैं सादर आमंत्रित करता हूं। उन्होंने सभी के वक्तव्य सुने हैं। आदरणीय प्रोफेसर लक्ष्मीकांत द्विवेदी सर। गुरुदेव तक मेरी आवाज जा रही है?
सभी विद्वानों को नमस्कार, शुभ संध्या। चर्चा सत्र में काफी अच्छा इंफॉर्मेटिव रहा और आयुर्वेद में हम किसी एक बीमारी को इसमें नहीं ला सकते और विभिन्न संप्राप्ति बना करके संगठन के आधार पे हम उसका संप्राप्ति विघटन करके और रोगी को लाभ देते हैं। पर्टिकुलर एक कोई दवा नहीं होगी और पुरुषम वीक्ष्य जैसा आयुर्वेद का सिद्धांत है, उसके आधार पे कुछ परिणाम मिलते हैं इसको देख करके। और एक चर्चा में वक्ता ने बोला था भंडारी करके कोई द्रव्य है, तो वो भंडीर है या भंडारी है ये मैंने पूछा भी है चैट बॉक्स में। और दूसरा, जो भी कुछ चिकित्सा क्रम है वो तो अपनी जगह, किंतु जहाँ औषधि निर्माण की बात है वहां भी तो गोपी चंदन आदि वटी है, तो गोपी चंदन हम कहते किसको हैं? द्वारका में जाते हैं तो कुछ और है, कहीं पीत चंदन है, तो वो द्रव्य का भी थोड़ा निश्चित ही होना है। औषधि निर्माण के हिसाब से ही मैं तो बात कर पाऊंगा, उसके हिसाब से मेरा एक प्रस्ताव है। और फिर सभी विद्वानों ने जो इस पर चर्चा करी वो वास्तव में मानसिक भाव भी इसके साथ जुड़ते हैं, ये बात सही है। क्योंकि जो चाहे उसको आप हार्मोनल बोल दें